Fear of catching COVID-19 is triggering a dangerous and ironic development. Millions of American kids are skipping vaccinations.
So here's a report. According to the Blue Cross Blue Shield Association, an analysis of medical claims shows kids are on track to miss an estimated 9 million vaccine doses this year. Measles shots are down 26% from last year. Polio vaccinations are down 16%. Medical experts say the worry that preventable diseases could become a public health threat yet again. Joining us now to talk about this new report is Dr. Mark Butterly. He's the vice chairman of the pediatrics department at Advocate Children's Hospital in Oak Lawn. Nice to see you.
Good afternoon.
Good afternoon. Okay, let's talk about this. You saw these numbers. You've looked through this report. What's your level of concern right now when you look through those numbers? What are you thinking?
Unfortunately, it is a staggering number of patients that will be getting their preventable vaccines ultimately. And that is a concern, not only going into the winter season, as we know COVID is still raging in our communities, but for the implications of school return and otherwise back to socialization for these children.
And what do you think is driving it? Is it a fear of going to a doctor's office and catching COVID, or is it just people who have kind of let a lot of things go during this pandemic?
Well, the first concern was ultimately that a lot of our clinics were simply not open during the peak of what we're calling sort of first surge of the COVID pandemic. There was so much about the virus and the infectivity that we were uncertain of. A lot of our clinics ultimately were not necessarily able to see children and provide them their vaccines. The addition of that as the COVID pandemic continued, with so many children not necessarily returning back to school, the urgency of getting those 4 to 6 year old health maintenance visits and booster shots simply didn't exist. And lots of families kept their children home ultimately, since that was not a requirement to get back into school. And definitely at this point, there is fear to return back to any healthcare facility or environment.
Yeah, let's talk about catching up right now. So, at some point, these kids are going to have to get those vaccines. I assume for many families, it'll happen once the pandemic is done. Are these public health officials, these doctors' offices, preparing for kind of how do you get these kids to catch up with some of these vaccines? What do you do to catch everybody up in a short period of time?
At this point, we know much more about how to prevent transmission than we did back in the April timeframe when some of these clinics were closed in the first place. So a vast majority of clinics, ultimately health systems or private clinics, have put protocols into place to keep sick children ultimately away from healthy children, prioritizing those healthy children to get their vaccines, including vision checks, developmental screens, and behavioral health screens as well. So at this point, we are welcoming children certainly back into our clinics with high priority to get caught up on these vaccine preventable diseases.
All right, Dr. Mark Butterly, the vice chairman of pediatrics at Advocate Children's Hospital in Oak Lawn. Thanks for joining us.
Thank you very much. Take care.
Coming up for us, another